Hello, we're going to get started in about 1 minute. Good afternoon, everyone. I want to thank you for joining me for this webinar. I wanted to do this webinar because I saw something that said, how can you help? And one of the ways that I know that I can help is to answer health insurance questions for anyone that has any type of questions. We're not going to be on here long. I put together maybe about a 10 or 15-minute presentation, but it is going to be dependent upon any questions that you have because I want to be able to answer your questions also. If you have a question, there is the ability to click on the chat button and you can send the question to me and I will answer the questions live for you. You can also, if you are on a computer, you can also ask to speak. If you ask to speak, you do need to know that when you come on the video, it will be you on the video with me. So you may just want to do a chat instead of actually speaking. I'm not going to actually show my face this entire time. I just wanted to greet everybody and say hello. There is also a delay, a little bit of a delay. So if you ask a question, it may take me a second to be able to see the question, but I will answer it as soon as I see it. Okay, so I'm going to go ahead and get started. Some of you are actually my customers, so you know me, and others of you do not know who I am. So I'm just going to tell you a little bit about myself, and then I'm just going to jump into the presentation. My name is Janine Davis. I am actually a licensed insurance health agent here in Michigan and actually a couple of other states too. I own a company called Lifestyle Safety. I have probably over 25 years experience in insurance and 15 years with sales and insurance. I work with all of the major carriers in Michigan. I've helped many, many, many people. I have offices in Detroit, and that should say Southfield also. And I have clients all over Michigan. One of the things that I really like to do is try to take care of people. I try to treat people like I would want someone to treat my dad or my mom. So that's one of the big things for me. But the reason why we're here today is to talk about health insurance in the midst of this pandemic and in the midst of this crisis. So I'm going to take my face off of here and just go ahead and dive into the presentation so you can see the presentation. So some of the things that I want to talk about today is a loss of coverage from an employer and what that means for you if you do have a loss in coverage. So if you have a loss in coverage, that opens up what's called a special election period. With a special election period, that means that you can get coverage outside of the open enrollment, and the type of coverage that you get will be the same type of coverage that you would have gotten had you gotten coverage during open enrollment. So that means that you're going to be covered for pre-existing conditions. You're going to have prescription drug coverage. You're going to have maternity coverage. All of those things are going to be covered because you're going to have the regular type of insurance because of the special election period if you lost coverage. If you lost coverage through an employer or any other way and you were in the marketplace, then you are going to want to contact the marketplace because you're going to want to update your application. You update your application by reporting a life change. That's also going to be if you lost coverage or if your income has changed, because some people have not lost coverage because they pay for it themselves, but their income has changed. If your income has changed, you also want to report a life change, because if you report a life change, that means that your premium may be lowered. The type of coverages that you are eligible for may be changed in a way that benefits you more. So you definitely want to update your application on the marketplace. You can do that by either contacting your agent, calling 800-318-2596, or going to healthcare.gov and updating your account there. One thing that I do want to make sure that you are aware of is that if you do a change today, it will go into effect by May the 1st. If you do it after today, it won't go into effect until June the 1st. So if you've had a change in your income as a result of this pandemic, I would suggest that you do everything that you can to make the change with the marketplace today, so that that change will go into effect by May 1st, and will decrease the amount of your premium. Um, Another way that you can get coverage is through Medicaid. If your income is less than 138% of the federal poverty line, then you are eligible for Medicaid. And the nice thing about Medicaid is that if you've had bills in the previous 3 months, Medicaid will go back and pick up those bills for you. So if you've got a marketplace application, you can actually update your marketplace application and it will let you know if you are eligible for Medicaid. But if you do not have a marketplace application, say you have not done it before, you can actually go on www.michigan.gov/MIBridges. And when you go there, you can apply for Medicaid, and you can also apply for other benefits that the state is offering at this time. That could be cash assistance, or that could be food assistance, or anything like that. So you want to make sure you take note of that. It's www.michigan.gov/MIBridges, and that will allow you to apply for any other benefits. This next slide is going to be a slide that's going to kind of show you what the income limits are if you are eligible for Medicaid. So for instance, if in your family you have 2 people in your household, if your income for the year is going to be less than that $23,335, that means that you are eligible for Medicaid, and you are going to want to apply for Medicaid coverage for you, because with the Medicaid, you're not going to have a lot of out-of-pocket costs. You may have some copays, but they're going to be a lot less than they would be if you were having regular insurance. So this chart just kind of shows you what those income limits are. So you want to look at what you've made so far this year, and you want to project what your income is going to be for the year based on what you've made to this point and what you think you'll make based on the rest of the year. Okay, hope that helps. Okay. So I did want to put something in here quickly about Medicare. If you are turning 65 in the midst of this, or you're becoming eligible for Medicare in another way, say that you are over 65, you've lost your job, and your job was giving you health coverage, but you've lost that coverage. So what you would want to do is you would want to contact Medicare. You would want to contact the Social Security Administration, and you would want to apply for your Medicare's Part A and B. You can contact the Social Security Administration. You can either do it online by going to www.ssa.gov, or you can call them at 800-772-1213. Because if you've lost your employer coverage, again, that's going to open up a special election period for you if you're over 65 and eligible for Medicare. So you are going to be able to get your Medicare benefits in place for that too, but you do need to sign up for that. And that also means that if you're signing up for your Part A or your Part B, that also means that you're going to have special election periods for Medicare Advantage plans or Medicare supplement plans also on the prescription drugs. So some of the resources that have been made available, one of the big things that is going to be important for people is telemedicine. Telemedicine allows you to talk to an actual doctor, and they can prescribe medications for you, and they can kind of diagnose you over either your computer or over your phone. With some people, you can download the app for the insurer that you have, and then there is a button inside the app that's going to be a telemedicine, that's going to connect you with the telemedicine. If you are not certain how to do telemedicine with your insurer, you definitely want to call the customer service number on the back of your card, and they'll be able to give you more information with regard to that. You can also contact your doctor. Many of them also have the telemedicine portion where you can contact them, or Beaumont has this free screener. You go to www.beaumont.org, and with this free screener, Beaumont is actually screening people to see if they have the virus over the computer again, and then they'll let you know whether or not you want to go to, whether you need to go to the emergency room or what is it that you need to do. So that is another resource that is available for you. One of the things that I wanted to mention also is if you have health insurance directly from their insurer, say for instance, you went directly to Blue Cross Blue Shield, you did not do the marketplace at all, or Priority Health or whoever you may have, you may want to contact them if you're having financial difficulties and see if they have any programs available that can kind of help you with that premium. Yeah. Okay. Oh, I'm sorry, that was my next slide. So if you have insurance directly from the insurer, definitely give the customer service number a call, because with everything that's going on, a lot of insurers and a lot of people are at this point really trying to help consumers and their customers. So give them a call. They may be able to do something with regard to your premium. So that would be beneficial for you too if you don't have the marketplace or something like that, or if you're not eligible for the Medicaid. So most insurers, I spelled that wrong. Most insurers are covering your diagnostic testing, and they're going to cover that for free for you. So if you think that you may have the virus, please go and get tested, because your insurer is going to cover that for you. And many of the insurers are also going to waive any type of deductibles and copays that you may have. So you may have deductibles and copays along with this. And so you definitely want to look into that. And you definitely want to go to the doctor if you need to, because you're not going to have to pay anything out of your pocket. One other thing that I wanted to mention on here too, I'm not sure if it's my next slide, but is short-term medical insurance. Say that you don't have any type of health insurance, you didn't go through the marketplace, you're not eligible for Medicaid. You do have another option, which is short-term medical insurance. Short-term medical insurance is going to be less expensive than the regular insurance, but the downfall or the downside to short-term medical insurance is that it's not going to cover any type of pre-existing conditions. What is a pre-existing condition? A pre-existing condition is anything that has been diagnosed or treated within a certain time frame. Many of the short-term medical plans are going to look back at least a year, maybe 18 months. So if you have been diagnosed or treated with anything, it's not going to cover that. It is going to cover anything new. So if you've not been diagnosed or treated with something and something new comes up, a short-term medical plan will cover that. But if it is exacerbated by anything that you already have, it's not going to cover that. So that is an option for certain people, and it is going to be a lot less expensive. It's an option to use as a stopgap. Other insurance coverages that you may want to consider during this time is hospital insurance and disability insurance. Hospital insurance actually pays you directly. If you are in the hospital, a hospital insurance is going to pay you anywhere from $100 to $900 per day that you are in the hospital. That will help you to cover any expenses while you're in the hospital. So that's something to consider during this time. And also disability insurance. If you are sick and off work, then the disability insurance will cover about 60% of your income. So you would still have 60% of your income coming in. But the only thing about disability insurance, there will be a bit of a waiting period before it kicks in. But that is something to consider as we are going through this pandemic also. I really didn't have anything else for you at this time. I did want to open it up to see if you have any questions or anything like that, because I think it's important that we are that your questions are answered. I know that there's a delay, so I'm going to give it a couple seconds. Okay, so I am going to put up that chart, that Medicaid chart again, so that you can see what those numbers are. So if your household comes within this chart, look at the numbers, you may be eligible for the Medicaid. And where you want to apply for the Medicaid is www.michigan.gov/MIBridges. That's where you would want to apply for the Medicaid. Also, if you have a marketplace application, you can update your marketplace application, and if your income falls within the limits of Medicaid, it will automatically send your information over to the Medicaid, over to Michigan Medicaid Department of Social Services. Yes, you can keep your marketplace coverage. I was just asked if you have marketplace coverage and planned on $20,000 income in 2020, and now you have no income for 2020, can you keep the marketplace coverage? You can definitely keep the marketplace coverage. You're just going to have to pay that premium. You're still going to have to pay your marketplace premium coverage. So whatever that premium is, you're still going to be responsible for that premium. If you, or you can go to Medicaid. So the choice is yours. Either you can go to Medicaid by changing your application, and then you'll be kicked over to Medicaid, or you can continue your marketplace as it is, and as long as you can pay that premium, you'll be fine. But what I would suggest, you're saying that your income was $20,000. What I would suggest is that you might want to go into marketplace and lower that income so that your premium will be a little bit lower. So that is going to be up to you. If you don't have any income, they would want you to go to Medicaid. But if you choose not to change your application, then your marketplace will stay in place. And what may happen is next year, because every now and again, the IRS will change your, will check your income. So if next year they come back and they see that your income is different, then they may try to kick you over to Medicaid at that point. But if not, then you'll be fine as long as you can pay that premium. You're welcome. You're welcome. Do I have any other questions? Like I said, this is just a quick webinar just to answer any questions that you may have with regard to the to what's happening. I do want to, for the last couple minutes, I do want to just let you know that if you have questions or if I can be of assistance, you can also schedule a 15-minute consultation with me, and I'll be more than happy to answer any questions that you have if you have more specific questions that you want answered. If I'm going to give it like another 30 seconds, if I don't have any other questions, I'm going to go ahead and end the chat. I just want to say thank you for joining me for this webinar. If you have any questions later on, You can always email them to me and I will email you back, or you can call me and I will answer those questions for you. Okay? Thank you so much. Have a wonderful afternoon and stay safe. Take care. Bye-bye.